Hi, everyone. Thanks for joining us. I'm Deb Fournier. I am the Director of Health Law and Policy for the Institute for Health Policy and Practice. And we are here today to talk about special enrollment periods, employer-sponsored insurance, for marketplace coverage, and other options. And so to discuss special enrollment periods, we brought together some leadership from the folks in our state that think about and take care of insurance coverage options for a wide variety of people. So we have our Deputy Medicaid Director, David Chorney, and one of the leaders of one of our navigator organizations, Keith Ballingall, and leadership, the Director of Life and Health from our New Hampshire Insurance Department. That's Michelle Heaton. And we are going to discuss open enrollment and special enrollment and opportunities for people who may have lost Medicaid eligibility or other coverage so that they can access employer-sponsored insurance or marketplace insurance. So before we begin our discussion, can you each just please take a moment to say hi to the audience? Dave?
Sure. Hi, I'm David Chorney, the state's Deputy Medicaid Director.
Keith?
Keith Ballingall, President of Health Market Connect.
And Michelle.
Michelle Heaton, I'm the Director of Life and Health at the New Hampshire Insurance Department.
Great. Okay. So our agenda for today is going to be, we're going to do some welcoming which we just did. And then we're going to set out some goals. We're really quickly going to look at a glossary because there's a lot of specialized terms in healthcare insurance. So that folks are all on the same page about what we are talking about. And you'll hear these terms a lot today. And then we will go over some conditions in which special enrollment periods will happen with employer-sponsored insurance and marketplace insurance, and then some other coverage options. So if we could go to our glossary, just really quick. Oh, our goals. So this came about because the end of continuous enrollment in Medicaid that occurred in 2023 triggered transitions in healthcare coverage for thousands of people in our state and millions of people across the country. And so our leadership from Medicaid, as you saw, and from the insurance department, as you saw, and our navigator organizations, we wanted to come together to highlight some of these special enrollment periods and to highlight what people's insurance coverage options are beyond Medicaid. Next slide, please. So here's our glossary. Employer-sponsored insurance is often referred to as ESI. So it's job-based health insurance coverage. It's often offered as a condition of being an employee with an employer, and it's a benefit of having an employment position. It's the most common way that Americans receive their health insurance coverage, and it is still the most common way that people in New Hampshire receive their health insurance coverage. Marketplace is shorthand for the Health Insurance Marketplace, or healthcare.gov, which was created by the Affordable Care Act in 2010. Sometimes it's also known as the exchange. Next slide, please. So there are open enrollment periods that you'll hear about. And this is a standard feature of insurance, and it is essentially a designated time every year when a person who doesn't belong or hasn't yet or wants to switch health plans can do that and apply for health insurance or make a change to their health insurance coverage without any other event happening. A special enrollment period is a time outside of that annual enrollment or the open enrollment period when a person can sign up for health insurance coverage after some kind of qualifying event or triggering event, like losing healthcare coverage or having a baby or adopting a child or having a significant change up or down in household income. So you'll hear these terms a lot, and these slides will be available so people can go back and read if they need a refresher on exactly what they mean. All right, So we want to first jump into special enrollment periods and employment-sponsored insurance. Okay, so the first thing we want folks to know who may have lost Medicaid coverage or some other coverage is again, most people are covered by employer-sponsored insurance in New Hampshire. And under federal law, if an employee who is eligible for the employer's health plan but not enrolled in it, if that employee loses their coverage under another program, including a Medicaid program, then they get a special enrollment period. They have a certain span of days within which to sign up for the employer-sponsored insurance, even though it isn't the open enrollment period. And under federal law, the employer has to provide 60 days for the employee to request coverage, and it has to be 60 days that follow the loss of the other coverage. So really short headline for this: be sure to ask about your job-based health insurance. Then there's even a little tool on the slide. If you click that tool, it'll open up into a form that you can give to your employer and ask them to fill it out. And that will apprise you to some extent of what the health insurance benefit, if there is one, what it is, and what it entails. Okay. Now we're going to go on to talk about special enrollment periods and the marketplace. So I want to bring on our navigator representative, Keith. And Keith, I'm just wondering, can you give people a little bit of information about what the marketplace is, like an overview of the marketplace, and then the concept of open enrollment and when that might happen on the marketplace?
Yeah, sure can. I mean, you went through a little bit of it in the glossary. New Hampshire uses a federal marketplace. So the terms marketplace, healthcare.gov, the exchange, all interchangeable. It's the same platform that anyone in New Hampshire can use to go online and see if they qualify for credits and to purchase health insurance. It's the federal marketplace, and that's a little important because the states that surround New Hampshire all use state-based marketplaces. So if somebody moves here just from a state next door, it's a little different system. You'll also hear FFM, federally facilitated marketplace, same thing. Usually somebody can get in during an open enrollment period. And lately that has been November 1st to January 15th. And I say lately because it is minimally November 1st to December 15th. So that's probably really a more important period to remember. If anyone's going to try to sign up, try to do it by December 15th. But lately we've had a little extended time to do it. There are points where we have things that happen outside of that period of time where somebody might be able to have access. And you've noted it here as a special enrollment period. And sometimes we would refer to that as an SEP.
So Keith, can I ask you, and if someone were to sign up during open enrollment on the marketplace, and they did it December 1st, would they get insurance? Or, sorry, let me back up. On November 1st, let's say they purchased on the first day of open enrollment, do they get insurance for December 1st?
That's a good question. That's going to go one of two ways. If they're doing it as the open enrollment period, that starts January 1st. But if they actually are coming in because something happened and they're leveraging one of the reasons for a special enrollment period, they'd actually start December 1st.
Oh, okay. So there's lots of nuance there. Okay. Which is why you talk to a navigator, because they can explain the nuances of how the marketplace works. Okay. Right. Let's go on to so you said that there were special events that could allow you to sign up for, if something happened that gave you a special enrollment period. So let's go to the next slide. And can you tell us a little bit about, there's a lot of information on that slide. What are some of the circumstances?
Yeah, this boils down to what changed, what happened, right? That's mostly what this is. And most of the time it's somebody might have lost coverage, right? They changed jobs or they no longer have Medicaid. That's most of what we see. But it might expand into maybe somebody got married or had a child or adopted a child. Those things come up. We mentioned moving here from another state. It might even be from another country, right? That is somebody changing and losing coverage from where they came from. Then you get into some that are a little more nuanced. The Medicaid coverage gap, we're fortunate that doesn't apply here really in New Hampshire. We're actually really lucky that wherever anyone is really in an income spectrum, they're going to be covered under some program. And if they're questioning, that's where Navigator's happy to help them understand where that may be. But if their income changed, and it's noted here, the tax credit or a cost share reduction, and that's a thing that they really can't see. But if somebody had a change in income, again, we're glad to have that conversation with them to see if this is a way they can get coverage in the marketplace or maybe save money through a plan in the marketplace. It's also noted here, immigration status changes, that comes up, they're eligible for coverage. And maybe there was an error someplace, and an error can be in a number of different ways, right? Was there a computer problem that happened that wasn't the fault of any of us individually, or maybe representative challenges, right? They called healthcare.gov, or they used a navigator or a broker and something wasn't quite correct that they were told. Those could be ways that they could get in or change their plans. And then we get into some that are even a little, we see a little less often. Disaster declarations. We don't have those as often in New Hampshire, fortunately, but sometimes those will come up where we'll be told, okay, because of some event that happened, we can get coverage. But it is important to know any domestic violence related issues that actually might give us an opportunity to assist somebody with coverage.
So there are a lot of events that could happen that could make it possible for someone to sign up for marketplace coverage if they are outside the open enrollment period. And there's one at the really bottom right-hand corner that says they're temporary, and I want to talk about both of them. So can we go to the next slide? So tell me about this temporary marketplace SEP for people who lost Medicaid coverage during the unwind. And Dave, I wonder really quickly first, do you want to talk a little bit about the unwind and what it is and why there would be a special enrollment period for this?
Yeah, sure. So the unwind was a function of the COVID-19 public health emergency. And during the public health emergency, states did not have to redetermine someone's Medicaid eligibility on an annual basis. So what that means, if you were going to lose coverage during the PHE, you were protected and you wouldn't lose your Medicaid coverage. That changed when the PHE ended. And starting for New Hampshire in April of last year, New Hampshire was required to start the Medicaid redetermination process for individuals. And that process is largely complete for those that were protected during the public health emergency. But throughout that redetermination process over the past year, if you lost your Medicaid coverage because you were over income or no longer eligible for Medicaid, there was a temporary special enrollment period where you would be able to go to the exchange and enroll in coverage through the marketplace.
And so the unwinding term, that's related to unwinding that continuous enrollment that happened during the PHE for Medicaid. Okay.
Yep.
And so there's a special enrollment period, and it was originally March of 23 through July of 24. But Keith, how long is that special enrollment period now for those who lost Medicaid eligibility?
Going right up until the end of November. And it kind of keeps pushing out. I think the big thing to remember here is through the time of COVID, we had a system that basically, instead of really making sure people went to marketplace or Medicaid, it said, let's make sure we take care of everybody, right? And a lot of people got into Medicaid. And then now the system's saying, okay, let's make sure people are in the right spot. Right. So that's kind of the process that's happening. For us, what's wonderful is going all the way back to if somebody lost their Medicaid back to April the 1st of last year, we're able to utilize that to say, okay, that provides us a special enrollment period and we can help somebody get into the marketplace today.
So let's pretend. So if I lost coverage in in April tax day, April 15th of last year of 2023. And I came to you as a navigator today, May 30th of 2024, over a year later, I could still be granted a special enrollment period for losing my Medicaid last year.
Absolutely.
Okay, so now I want you to talk me through a little bit about how do you access this special enrollment period? Like, what do people do to?
I think this is where this is helpful, right? So people understand, again, some of these unique pieces. But from a simple perspective, enroll in healthcare.gov, right? Right. And they can do that on their own. Call healthcare.gov, leverage one of the navigator organizations to help them enroll, to get, enrolled into a new program. I mean, it's really using the application.
And would I have to sign something? Do I have to submit something in writing to show that I lost my Medicaid coverage last April?
This is one of those simpler processes where you say, I lost it, right? There's no really challenging proof to have to provide. You're just letting the system know that, yes, this affected me. Yes, I lost my coverage and I am eligible.
Okay. And then if there are people still in the unwinding process, people who have been protected in Medicaid and are just now starting to initiate their renewals or their redeterminations for the first time, but they know they're not going to, like maybe their renewal is due, let's say in August of this year. So I come to you and I say, Keith, I still have my Medicaid coverage, but I know I'm losing it. And I know I'm losing it in August. Can people sort of advance plan and jerry rig something to be set up so that they don't have any gaps in coverage?
Yeah, I would say in general, we can advance plan as far, into the future as people need to have discussions, right? But in terms of actually doing the enrollment, there's a window 60 days ahead of time, right? 2 months ahead of time where somebody could really do the enrollment ahead of time and ensure that coverage is in place. And that's a general, that's for any actually upcoming loss of coverage, that 60-day window.
So that's for all the SEPs, not just this one.
Correct.
Okay. All right. So let's go to the next slide because there's another special enrollment period, another SEP that I want to talk about. And that's for folks with incomes up to 150% of the federal poverty level. So can you give us a little description of this and then, really maybe define like who it is and how it works?
Yeah, I mean, this one, it starts to become a little narrower from a marketplace perspective, right? But I think what's important to know is up until a certain point of income, somebody's going to be able to get coverage, right? And the Medicaid side of the world, it's up to 138% federal poverty. And then there's a narrower piece where they would actually go into the marketplace. But I think what's important to know, and I think having conversations with back to navigators again, is anytime something feels expensive, let's have that conversation, right? Because they may qualify for this program to be able to apply for coverage. If something is too expensive at an employer, right? And that's a calculation the system does. There is another opportunity really to look at coverage through the marketplace and maybe save some money. So I think if it feels expensive, let's talk it through and see if there's something else we can do.
Okay. And to get that financial help, you have to go through healthcare.gov to get some financial help with the paying for the plan.
Yeah, this is where that application, it's one application and it literally does everything behind the scenes, right? It lets you look at the plans. It lets you make sure that everything works from doctors and prescriptions. It does the calculation of as far as tax credits or lowering deductibles. Everything is done for somebody. So doing that application is the most important thing. Okay. And actually, I'll add, if the system also says if you started here in the federal marketplace and it thinks you qualify for Medicaid, it'll send your information to the state for you.
Automatically.
Yeah.
All right. So it sounds like these are situations that can be difficult for people to navigate, which is why we have navigators. who can help with making some sense of what some insurance coverage options are. And we have folks like you here today to help explain some ways that people can get some help. Okay, so since we're talking about navigators, let's learn about our navigators. All right, next slide, please. So Keith, you are at Health Market Connect. Can you talk about what resources are available to people at Health Market Connect and for what price?
Yeah, the price is beautiful. It's nothing, right? We are funded through a federal grant. So we're here to assist at no cost any resident in the state of New Hampshire. And that assistance will help with the application, or maybe you already have a plan and you want to talk through how it works. A component of what we're required to do is help educate. So we will have any of those conversations that anyone wants to go through. We do a lot on the phone. We do a lot via Zoom or video. We have purposefully tried to make sure we have people who reside in the different parts of the state of New Hampshire, partly because the state is unique in different areas, and partly because if somebody wants to meet in person, we want to try to make sure we can make that happen.
That's great. And it looks like you have a lot of language assistance. So for people who are not native English speakers.
Yeah, we've also tried to make sure as best we can how we can assist people in a native language who might live here in New Hampshire, but maybe English is not their first language. So the best that we can have somebody here locally on staff, we do want to try to do that. I will say, if we don't have that on staff, we will work with healthcare.gov to assist anyone in whatever their language is. So whoever it is, will provide the help.
That's great. And let's go to the next slide. In New Hampshire, we're really lucky because we have 2 navigator organizations. The other one, really briefly, is First Choice Services. And they also have some on the ground counterparts here that are included on the slide. And there are also some embedded in some healthcare facilities and healthcare provider offices. There are people who can also assist with health insurance applications. So let's go to the next slide. And just really quick for people. So if you want to talk to a navigator, it's free of charge. Call the number or look up their web pages. And just really encourage folks that if a navigator is the route you want to take, please reach out to them with your questions. And there are other options. So we should really spend some time talking to the New Hampshire Insurance Department about some other insurance coverage options and some considerations everyone should be thinking about when they are thinking of purchasing health insurance coverage or trying to purchase health insurance coverage. And we're going to be joined by Michelle Heaton, who is the Director of Life and Health for NHID. So Michelle, thank you. Welcome. Thanks for joining us. So tell us really simply what the New Hampshire Insurance Department does when it comes to health insurance policies in New Hampshire.
So the insurance department serves a couple different functions. One, we license and regulate all insurance entities. So those are all our insurers. We want to make sure they're financially sound so that in case someone who has purchased insurance needs to use that insurance for a reason, the money's there to cover the claims. The other aspect that we regulate, especially with respect to health insurance, is that we review all policies before they can be sold in the state. So we regulate the insurer and we make sure that whatever they're selling in our state to our residents complies with state and federal law. And there's some really important protections in health insurance. And some of the big ones that came around with the ACA, but we already had a lot of these in place in New Hampshire, even before the ACA, is guaranteed availability and renewability, and no pre-existing conditions exclusions. And these are very important because it makes sure that anyone can buy insurance and their insurance cannot be canceled because they file a claim or they get diagnosed with a health condition, and they cannot have coverage excluded because they have already been diagnosed with a condition or have had health conditions in the past.
So super important protections for consumers, things that we heard about for generations prior to the mid 2000s. Okay, and are there other consumer protections that NHID also enforces? I think there are. Can we go to the next slide?
Yeah, so these are just a couple of the big highlights. There are a lot of consumer protections built into health insurance plans. There's a lot of rules and regulations about how the plan needs to be administered, and we regulate all aspects of that. So we not only look at the policy when it gets filed, but we also look at how the insurer is implementing the policy. And if they're not doing something according to the policy or according to law, we can step in and correct that situation. Some of the other really important consumer protections are in the individual market. All policies are required to cover the essential health benefits, and those are listed on the slide here. There's 10 different categories, so it's very comprehensive coverage, especially compared to some of the major med policies that existed prior to the ACA. There's also a slew of state mandated benefits that all insurers are required to cover in New Hampshire.
So NHID makes sure that the policies cover all of the items that it's supposed to cover under state and federal law, and then that it treats the people who it protects in accordance with those laws also. That's great. Can we go to the next slide and we'll talk a little bit about who can sell insurance, who is licensed to sell insurance on the individual market in New Hampshire?
So currently for the plan we are in, which is plan year 2024, we have four licensed insurers that are able to sell plans in the individual market. And those are Ambetter from New Hampshire Healthy Families, underwritten by Celtic Insurance Company, Anthem Health Plans of New Hampshire, who also does business as Matthew Thornton HMO. And we also have Harvard Pilgrim Healthcare of New England. So these are the only 3 licensed insurers that are able to sell plans in the individual market. So if you see a plan that's not from one of these insurers, it has not been approved and it cannot be sold in New Hampshire. So that's something to be aware of as individuals start shopping for plans.
Okay, that's
and
great.
All plans on the healthcare.gov are from licensed insurers and have been approved. It's a trusted website, and anything on that website is meeting all legal requirements.
Okay, so you heard it here, folks. If it's on healthcare.gov, they've already kicked the tires. They've already checked it out, and those plans are good to go. Okay, so can we go to the next slide? We heard a lot earlier, and we talked earlier about navigators. Can you help us understand the differences between licensed insurance agents and navigators?
Sure. So another thing that we do at the New Hampshire Insurance Department is we also license and regulate insurance agents or brokers. And these people have specialized training, have met certain education requirements, have passed the test, and continue to advance their knowledge in the fields. These licensed agents have in-depth knowledge of the different products and would be able to answer very detailed questions about the products and can help consumers figure out what type of plan will work best for their situation. Navigators, on the other hand, are not regulated by the insurance department and have a little bit more of a limited capacity. They can assist consumers in the process of where to go to obtain the insurance, but they cannot provide individual advice about what specific plan you should choose that's going to be best for your particular situation. So if you need any questions about that, please reach out to a licensed insurance agent.
Okay, great. And can I buy a healthcare.gov plan with a broker or an agent, or do I have to go to a navigator?
You can buy on the exchange to get your subsidies with the assistance of a licensed insurance agent. So the insurance agent will talk you through your different options. And if you would qualify for federal subsidies, that is the way they're going to recommend you go. And they can help you go through the different plans on the exchange and help you figure out which one's going to best fit your particular needs. And they will assist you in signing up for that coverage as well.
Okay, great.
One more important thing to note is that rates are another thing that we regulate at the insurance department as part of the form filings. So all rates have to go through an approval process, and we have to make sure that they're actuarially sound. Once the rates are approved, that is the rate for the product, and it does not change. So it doesn't matter if you go through an insurance broker or agent, if you buy on healthcare.gov, or you go directly to the insurer, the rate will be the same in all instances.
Do you still get access to the financial help that's on that for lowering premiums and out-of-pocket costs if you don't purchase through healthcare.gov?
No, you have to go through healthcare.gov, either with the assistance of a navigator or a licensed insurance agent, or on your own, in order to get the subsidies.
Okay, great. So let's talk a little bit more about that. If we could go to the next slide, and we'll talk a little bit about the financial help on the marketplace. What do you want people to know? Like if they only take away like 30 seconds of something on the financial help, what do you want people to know about the financial help in the marketplace?
Everyone should try to go to healthcare.gov or reach out to a navigator or a licensed agent to figure out if they would qualify for subsidies. And some people may think, oh, I earn too much. That's not for me. I'm not going to qualify. But on this side, you can see that there is assistance available for up to 400% of the federal poverty level. And this chart, if you're a family of 5, at 400%, that's 140,000. So based on median incomes in New Hampshire, a good amount of New Hampshire residents qualify for some level of subsidy. Now, this chart has 150, 200, and 400. These are different levels of how much of a subsidy you'll get. If you're at the 150% mark or below, you will likely get a plan where you don't have to pay anything. If you're above that, you may have to pay some portion of the premium, but you will have subsidies available as well. The higher you get, or the closer you get to the 400% mark, the lower the amount of subsidy and the more you would have to pay in premium. But it's good exercise for everyone to go through and see if they qualify, because they may be surprised.
Can I add in here one piece? I will say some of the conversations we have as navigators is, what does it mean family size, right? So and it comes down to what's on your tax return, but we're glad to have those conversations. And it's similar with income. There are so many people in the state of New Hampshire who are self-employed, and the question of what counts as income comes up. So even if somebody's going to do this themselves on healthcare.gov and just wants to have that level of conversation, navigators are glad to go through that.
Great. There's just so many nuances, and I think about it frequently, how lucky we are to have 2 navigator organizations in addition to our licensed agents and brokers. Okay. And it looks like on our slide that roughly 70% of people in New Hampshire who did purchase on the marketplace received some kind of financial help for either paying for their premiums or lowering their out-of-pocket costs. So it's a fair amount of financial help that can get spread around, even for people who are earning, above 200% of the federal poverty level. So since a lot of people are doing this on their own, let's pretend they don't go to Keith or they don't make it to a broker. Let's go to the next slide. Michelle, I wonder, what do you want people who are purchasing insurance to be thinking about as smart consumers? What do they need to know about purchasing comprehensive medical health insurance in New Hampshire if they're being a good Granite Stater and doing it on their own?
The easiest thing to do is to go to healthcare.gov. You don't have to worry about being sold something that's not approved or not qualifying for subsidies. You will check all the boxes if you go to healthcare.gov. If you're reluctant to do that, that's why we have on that previous slide, there's only those 3 insurers that can sell. If they're not selling it to you, it's not insurance. And the reason we want to warn people about that is because sometimes people click on something from a website or an advertisement that promises, a cheaper alternative to healthcare or health insurance. And you have to be very, very, very careful with these. These, for the most part, are scams. They will take your money, and then when you need to use that coverage, there's no guarantee you have any coverage. There's no guarantee they will pay anything. There are no consumer protections. And we, as the insurance department, have very little jurisdiction to do anything or to help you out. We do consistently go after these fraudulent entities and try to shut them down. So we can do that, but we're not going to be able to make the consumer whole. So you have to be very, very careful about clicking on things and searching around on the website. And really, there's no need to do that because everything is on healthcare.gov. There's the same rates everywhere. You're not going to get a better deal by trying to shop around using search engines. It's the same price everywhere. So really, the best way is healthcare.gov.
Okay. So let's go to our next slide because, we should maybe think through some things. What else should people look out for in terms of avoiding products that aren't necessarily comprehensive medical insurance coverage? Like, what else should people be wary of if they encounter something that says that it's health insurance coverage?
Sure. So in addition to just flat out scams, sometimes there are products out there that advertise as medical discount cards, and sometimes they can be advertised as an alternative to health insurance. These, again, are essentially a coupon. There's no guarantee you get a discount, and there are no consumer protections, and there's no guarantee you receive any kind of payment. Another thing to watch out for are policies that are issued by unlicensed entities. And I say they're policies because they're not really, because they are an unlicensed entity. They are not an insurer. There's no guarantee for payment. These policies have not been reviewed, but sometimes these scammers will put together something that really looks like an insurance policy. And you may not know that it's not an insurance policy until you try to use it and realize that you've been scammed out of the money. Another alternative is healthcare sharing ministries. These are a legitimate, I wouldn't say product, but they're a legitimate organization. These are not an alternative to health insurance, though. Again, there's no guarantee of payment or coverage. And while this may be an option for certain people, they really need to understand what they're getting into and that there are a lot of caveats to those. Also, also be wary of something that's being sold as a limited partnership plan or anything that makes you an employee or partial owner of something. These are oftentimes associated with you downloading some kind of app or browser that's mining your data and making you some kind of employee or limited partner. And in exchange, you'll get their healthcare plan. These, again, are fraudulent and you need to be very wary of them. So again, if you're considering something that looks a little fishy, please reach out to our consumer services department and they can help you sort through whether this is a legitimate plan or not. But again, if you go to healthcare.gov, you won't have any issues.
Great. So again, folks, if you're not sure if the coverage you're thinking of buying counts as health insurance under the law, Consumer Services Unit at NHID can help you out. 2 phone numbers, email. They're there to help you sort through what's available and what will actually operate as insurance for you. Okay.
Yes, and one more thing to be wary of: if you are looking for a licensed agent, just be careful what you click on. Sometimes there's websites that will say, click here and give us your phone number and we'll pair you up with a local agent. And then people are inundated with calls. So it's best to find an agent first and then reach out to them personally, as opposed to putting your information in one of those websites. Also, be careful when you're typing in healthcare.gov. And don't confuse it with similarly worded websites, because sometimes those will divert you to something that is not healthcare.gov and could be trying to sell you a fraudulent product or can hook you up with local agents. So just be wary of that.
I'll add, healthcare.gov has a nice feature called Find Local Help. And if somebody puts in their zip code, you can see anybody that is registered with healthcare.gov to assist, and you could narrow down by agents or brokers if you like, and you could narrow down by navigators if you prefer. So that right there will give you the list of people who can assist you in this space.
Thank you. This is fantastic information. I really just want to, can we go to the list of speakers? I want to thank our speakers for joining us today. Here's their email addresses in case you want to reach out to them. We really appreciate everyone's expertise and time. And we wish everyone who is watching this video well in your search for health insurance coverage.